Hello, everybody. I'm not real good at this, and I think I'm going to do this probably more for myself than I am everybody else. But I'm going to do it, and then everybody else can kind of follow with me if they want to. I'm sitting here, and I started the process back on January 6th. Today is February 3rd of 22. I went in, got a CT scan because my wife said, hey, we're going to be 50 this year. Let's go get our hearts checked. Well, the results come back, and I had an aneurysm of approximately 5.1. So I start checking in with specialists, and I go to a thoracic surgeon in Kansas City at KU. So fast forward to kind of where we're at now. I have to have a valve transplant and pretty much replacement from the valve up to the bottom of the aortic arch. Bicuspid valve with some calcium deposit with a dilated aortic root. So, some things for you to think about as you may go through the adventure is some of the questions you want to ask your surgeon. Maybe I'm a little different, but I wanted to know the mortality rate. For me, the mortality rate is between 1% and 2%. And that's of a stroke and dying. Several different things are involved in that 1% to 2%. The ironic part behind the whole concept is my life expectancy actually increases based on the average lifespan and things that have something to do with that. Due to the fact we have to take my body temp down so low, I believe it is 12 degrees centigrade, approximately 52 degrees. Because they have to drop it down so far, there is an increased risk of bleeding, which does mean that I do have a 15% chance of having to go back in and drain the blood after the procedure. I did ask my doctor about the onyx. I have a platelet deficiency. So, doing some of my own legwork, I asked about the onyx. His personal belief was he uses the St. Jude valve. I told him I'd rather use his expertise than my knowledge through YouTube. So please, don't trust YouTube. Don't trust everything else. If you're going to trust your doctor, if you're going to put your heart in his hands, trust your surgeon. Just some of my short questions I asked is make sure you know what the situation is. Ask if his options are different for the bovine implants and things like that, or if mechanical's better for you. I'm 49. He suggests the mechanical valve for me due to my age, and I'm a very active person. I don't lift weights. I don't run. I'm not active that way. I just don't ever stop. So this is going to be my first one. Nerves, getting the papers in from the hospitals, saying, hey, this is what, you need to start being prepared for. It kind of starts to hit a little different. But anyways, if you've got questions, feel free to ask, and I'll respond to them as I can. Like I said, today is the 3rd. I have surgery on the 22nd of this month. So from start to finish from my process, done with surgery, not rehab, but done with the surgery, I will be less than 2 months. From the time they found the aneurysm until the time my surgery is over is less than 2 months. So everything's coming fast for me. If you've got ideas for me to pay attention to between now and then, if you've been through it, trust me, I'll take the input. If you've got questions because you're maybe not as far along as I am, even though I've been only at it for 2 months, you can feel free to ask. I guess I could say I'm kind of excited, but nervous. 2 weeks from tomorrow, I have my pre-op. So it's going to start setting in. I'm not afraid of death, not afraid of dying. He just wasn't supposed to tap on my shoulder and say, hey, I'm watching you. So hopefully with the mechanical valve, fixing my aortic root and my ascending aortic, hopefully we get this taken care of and my life expectancy will go right back to that 80, 85 years old, or until somebody sees fit to take me. Anyways, that's this one. You guys have a great one. I'll check back. I don't know how many of these will do. I don't know how much I'll be able to do. But I'm here, and this is the first one. So, if you like, follow this. We can take this endeavor together. You guys have a great one. Thank you.